Hi everyone, welcome back to another episode of our Body 101 series. Today we're going to talk about something that is a huge epidemic in the United States right now, and that is about opioid medication and the opioid epidemic. So first let's touch on what opioid medications are. So opioid medications are one mechanism for controlling pain. And what these do is they attach to certain receptors in our brain, and it blocks negative pain signals from being perceived by us. And so ultimately it's just dampening down our pain response. At the same time, it actually ramps up signals that are of pleasure. So they help you feel good while they're also dampening down signals that hurt. So opioid medications have shown to be effective in controlling pain, but it definitely has come at a cost. Because they've been effective, they've been prescribed more and more and more, which has led to an opioid epidemic where people, because of the positive response that people get from them, they have become addictive. And there's been some really sad statistics in our country regarding people who have had opioid overuse and addiction. So over 1,000 people every day are treated in the emergency department across the US due to opioid overuse or misuse. And really sadly, from 1999 to 2017, 218,000 people have died due to misuse and overdose related to opioid medications. So because of all of these negative effects that have been starting to be seen, there's a shift happening where opioid medications are not being prescribed as often as they used to be, which is ultimately a really good thing. For people who have been reliant on opioid medications, it can be quite frustrating, but the good thing is that for you and for everyone else who's starting to have acute pain or has been experiencing chronic pain, there are other ways to help. One of those major ways is physical therapy for people who have had chronic pain, especially the biggest area that's studied is with low back pain. And so basically what they've been finding is that for people who seek physical therapy first when they start having pain or have been having chronic pain, there's an 87% reduction in the chance that you'll be prescribed opioid medications if you seek physical therapy first. Another huge effect that this trend might be having is decreasing healthcare costs. So right now there's $3.5 trillion spent on healthcare every year, and about 72% of that $3.5 trillion is spent on medications to control pain, as well as different surgeries and injections and diagnostic imaging. And so a large sum of our money is being spent on these medications, and if we can shift that away economically for everybody, it could be a very beneficial thing. At the same time, the cost of seeking physical therapy for treating chronic pain has shown to be effective, and it's much cheaper than even just going and having some opioid medication or other mechanism of treatment like injections or surgery. So physical therapy is a great option for anyone who has been dealing with chronic pain, maybe is trying to decrease their amount of opioids, or is trying to avoid them altogether.